We have an update now on a News4JAX Trust Index report we brought you last evening about Governor DeSantis' claim that people who have multiple booster shots for COVID-19 are more likely to get infected. The governor's office responded to our report citing CDC data. News4JAX, however, is standing by its decision that the governor's statement is not true. Tarek Miner is here to show us why. Tarek?
Well, a press secretary for the governor sent News4JAX CDC data that you see right here, which does show a greater frequency of COVID cases among boosted people than among vaccinated people who were not boosted. But this data only covers Americans ages 50 and up, and more importantly, shows a much higher rate of cases among unvaccinated Americans compared to anyone who is vaccinated. We showed the governor's office response to an expert in the medical field.
It's just really important not to draw conclusions from raw data. A lot of this data came from sources that have stated this is raw data and you should not be drawing conclusions.
Dr. Todd Husty, a county medical director in Central Florida, says the data Governor DeSantis' office sent the News4JAX Trust Index team doesn't support the claim that the governor made while speaking on Tuesday in Osceola County, as he criticized U.S. military vaccine mandates.
How is that saying as a country, thank you for your service, by kicking people out over something that doesn't stop you from getting infected in the first place? I mean, that's just what is so unbelievable about all this stuff. And in fact, I think if you look at the data now, the people that have had multiple boosters are actually more likely to get infected right now.
After the Trust Index team rated the statements that multiple booster shots make you more likely to get infected not true, a deputy press secretary for the governor, Brian Griffin, sent us this response and CDC data, writing, upon a quick review of my own accord, if you go to the CDC's website and reference the graph rates of COVID-19 cases by vaccination status and 2+ booster doses in ages 50+ years, you can see that those who received boosters after being vaccinated had more reported COVID infections than those who didn't get boosters. Taking a look at the graph, starting at the bottom, the blue dotted line represents people who were vaccinated but not boosted. The solid purple and blue line above it show people who have received 1 or 2 boosters. The CDC data does show a greater frequency of cases among boosted people than among vaccinated but not boosted people, but the black line on this graph showing cases among unvaccinated people are significantly higher than among any vaccinated group. Dr. Husty says this graph is statistically irrelevant.
There are a couple of reasons why it's not statistically relevant and not scientifically relevant. One is because there's very little data down there at the bottom. But the other is who went to get tested and why? And that's a huge question. That is unadjusted data. That's just raw data of this many people tested positive and this percentage of people, or this many per 100,000.
Dr. Husty adds that the CDC data is only a snapshot of people being tested and infected with COVID-19 because a huge portion of America's population is home testing and not reporting their illness. Husty says DeSantis' claim was based on a very small set of data.
The concept that those that are vaccinated and boosted are more at risk somehow is just flies in the face of everything that we know. We know that people that are vaccinated and boosted are 3 times less likely to get Omicron. Wow. I mean, we know that. So why don't we go with that, which is the vaccine works.
So after reviewing the full context of what the governor was talking about when he made the statement and the data the governor's office provided to News4JAX, the News4JAX Trust Index team rates the statement that people who have had multiple boosters are actually more likely to get infected right now as not true. Now, experts tell us that you cannot draw that conclusion solely from the data the governor's office cited. We also asked the governor's office to speak with us about the data on camera today. Deputy Press Secretary Brian Griffin emailed this response to me. Jeremy Redfern with the Florida Department of Health can also consider any further questions you have on the topic if they are legitimate health-related questions. But if this is a gotcha attempt, as it feels from the initial publication of the fact check this morning, we really do need to focus on the people of Florida. Redfern, who is the press secretary for the Florida Department of Health, responded as well, saying, how is this still rated not true when this data provided by Ryan shows otherwise? The state did not speak with us on camera today.